Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Waiting.
And I'm Dr. John Haverstock.
Okay, so we're doing sort of a follow-up video. One of the previous videos we made was on shoulder arthritis and total shoulder replacement. And that was sort of the traditional shoulder replacement. But now we're going to talk about something that's a bit newer, a little bit more expensive if you're talking about a hospital budget, but it's called a reverse total shoulder.
Could you just watch our video backwards?
You can, and you'll get the same information.
Same information. Okay, so what is reverse total shoulder, John? It's interesting.
So yeah, simply put, we reverse the sides of the joint. So normally when we do a joint replacement, we put the ball where it should be and the socket where it started. Here we reverse and we put the ball where the socket once was, and we put a socket on the ball side.
This is probably one of the biggest developments in like game changer for shoulder patients, right? Before it was pathology that had no solution, you were stuck, and now this is a really life-altering procedure.
Yeah, it's a huge advantage, and we can now treat things that we couldn't before. We said, sorry, good luck, or we can't make this better. Or we did a partial improvement, and now we can make a really big difference.
What you say, you don't say sorry, good luck.
Sorry, good luck.
Sorry,
Sayonara.
good luck. Don't let the door hit you.
So who gets these? Who is the person? What kind of pathology is appropriate for reverse total shoulder?
Yeah, so overall, it's about half of the people that end up having a shoulder replacement that might have a reverse total shoulder. And so the easy way to think about it is if you're missing some of the tendons, the rotator cuff tendons, in a meaningful way, maybe a tear more than a centimeter or so, you'll get a reverse total shoulder. Or if your socket or your bone is really missing some substantial bone.
Okay, so a reverse total shoulder in the setting where it's not just osteoarthritis, but osteoarthritis or rotator cuff arthropathy or something, plus some loss of anatomy, be it bone or soft tissue. You got to reconstruct it with a reverse total shoulder.
That's right. To have a normal total shoulder, an anatomic total shoulder, do well, everything has to be perfectly balanced. The socket and the tendons have to be perfect.
So this can make up for some of the inadequacies.
Absolutely.
Okay.
Okay, so tell us, is in terms of rehabilitation, I mean, just check out our last video. We talked about how to recover from the surgery. Is your recovery from a reverse total shoulder any different?
Not really, no.
Well, that makes a short video.
This implant, you got to have a few things to make it work well. You have to have a deltoid muscle, that's the big muscle on the outside, that has to work, okay? And also for a smooth motion and to be strong, you need to have the tendons in the back of the shoulder working. Sometimes they're not working, so we have to move a tendon to substitute for that. But the most important thing is that your deltoid is strong, and a lot of these people that need surgery, they won't have been moving. If you've ever seen a person kind of reach up like this and their whole shoulder hikes up, their muscle hasn't been active for some time, so it takes a little bit longer to get the full reach, I would say.
Do you have an X-ray of a total shoulder or a reverse total shoulder that we can see, John?
Yeah, absolutely.
Just explain what we're seeing.
Here's an X-ray that we've brought up. So on the shoulder blade side, the socket, the glenoid, we actually put this fancy metal implant into the shoulder blade. So it looks kind of drastic when you see it here. There's maybe 2 or 4 screws, and those are all inside the bone. We put a hemisphere onto the socket side, and then we replace the ball and a polyethylene or plastic socket. I can show you one. I've got one here.
That would be really cool if we got to see one.
Yeah.
A bag of tricks back there.
There we go. So just like the anatomic total shoulder, we're going to put a stem or a stemless into the humerus bone, and the bone's going to grow into that. We're going to add this tray, we call it, and this tray, you can see how it's kind of flat. It's because it's carved out, and it can accommodate, it can match perfectly with this ball. So they glide perfectly. The ball is secured to the shoulder blade by all of these screws, and again, a really roughened kind of metal finish that the body grows into and hopefully keeps it there forever.
You really have reversed it. You put the ball where the socket was and the socket where the ball was.
Absolutely.
So is it safe to say if someone tries to raise their hand, their arm stays still and their body goes up?
That would be impressive.
That would be impressive.
Okay, so now why don't we just always use a reverse shoulder, since it's more stable in that, than a total shoulder?
Great
What's
question.
the advantages and disadvantages?
Yeah, so I would say this is kind of the end of line for your shoulder. So if something goes wrong with your reverse shoulder replacement, we aren't sure we can fix it.
Right.
Ooh, that's ominous.
So it's a salvage potentially.
It's a salvage. We don't have outcomes beyond 20 years. So we don't know how it's going to do at 25 and 30 years, for example. It is actually more prone to dislocating than the anatomic or normal total shoulder because of that ball and cup system. Dislocation can be a problem. And the last thing is that it puts a little bit more stress on the bony roof of your shoulder. So because that deltoid muscle is doing all the work to lift, it can give you a stress fracture, which is, you know, weeks of pain, and you got to do some rest after. You need some rest to recover from that.
So after surgery, you're in the hospital a day or two, sling, and then physiotherapy. When do you start physio? How early on are people starting physiotherapy?
So you can start within the first days, but it's just simple stuff. It's, you know, making sure your hand and your elbow don't get stiff. You're learning precautions so that you don't you know, push out of a chair the wrong way, or no one pulls on your arm, because like I said, this shoulder can dislocate. It's not common, but it's possible. So you just, in the early phase, you have to be a little bit careful. Once you're out of the sling, you're kind of off to the races.
So it's still a 6-week sling thing?
Yeah, for most surgeons would suggest 6 weeks. There might be a few that are shortening it. Depends on the patient.
Okay, so let's say if you've had a total shoulder, an anatomic total shoulder, like our last video, and that one's eventually failed or failed for some reason, is a reverse total shoulder sometimes used as a bailout procedure after that first total shoulder failed?
Definitely. So when we go back in to redo a shoulder replacement, it's really hard to know that we're going to get the tendons to heal again, that the socket is going to, you know, fit well. So we have a lot more versatility. We can add some bone graft. We can make up for deficits with the reverse total shoulder. And so most revisions or redos would be to a reverse.
That's awesome.
Can I keep the implants?
Yeah.
Keep the implants. All right.
That's a really great summary of the reverse total shoulder, and helping a lot of viewers that maybe thought before they didn't have an answer for this very, very difficult problem. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
And thanks to Dr. Haverstock for joining us once again.
Thank you.
We'll see you next time.